This is Tom Dillon, the Lifetime Liberal, and today is Monday, June 26th, 2023. The title of this rant is 1 Year After Dobbs. So, forced birthers in 23 states after the Dobbs decision have enacted exceptionally, let's just say, restrictive women's autonomy and women's health issue laws in those states. And millions of childbearing women in those states are affected by this. Many of them have had to seek help by going out of state. Many of them also not even having the money to do that. It has not been a good thing for them at all. We also know that OBGYNs in these states are leaving, are considering leaving, and are very concerned about the health care that they can provide to the women in those states, especially related to pregnancy-related emergencies and pregnancy-related mortality, and which are also greatly in terms of racial and ethnic disparities that are going on in those states. Now, we have seen in the last year an exceptional number of near-death experiences from women throughout the United States, mostly in these states. And many of those are from women who never, ever contemplated that they would need to have an abortion, meaning that they wanted these children. There were medical emergencies regarding that, and they could not get the health care that they needed in that state, and their lives were endangered because of it. And right now, since Dobbs, women have responded in numerous ways. One way is there's been an increase in need for contraception, an increase for sterilization. And that has kind of shown that some women fear being trapped by forced birth laws in these states. There's been an increase in IUDs and implants. So even if Republicans thought that this would increase the birth rate, it hasn't, and it may not at all. Now, when it comes to what's going on with the law itself, the overturning of Roe versus Wade in the Dobbs decision, is that 75% of the women who are going to college say that where they were going to college, that they had to look at that to determine if that was okay based on these types of laws. Now, in terms of the voters themselves, right now, over 60% of all independents, 1/3 of all Republicans, and an extreme majority of Democrats. But this is really, really striking. 80% of all women in the childbearing age, meaning 18 to 49, and also 2/3 of all suburban women are basically opposed to this Supreme Court decision. So it will be a vital thing in the upcoming election. And Democrats have been very passive about this for a long time. They tried to tiptoe around it, and they've been screwed all over the place. But now these women's health issues will probably be the main issue, and Democrats are embracing it in every state that they can. Women's health issues should be determined by women and not by white men in red states. And let's hope that 2024 will put an end to the forced birther movement.